Aborting non-viable pregnancy. What is a non-viable pregnancy? A non-viable pregnancy is one in which the fetus or the baby has no chance of being born alive. Explicit diagnostic criteria have been designed to make clear when the termination of a non-viable pregnancy is warranted. Exacting uniform standards are used to eliminate variation in how reasonable chance of survival is interpreted to ensure the diagnosis of non-viable means that the fetus has died and or cannot live outside of the womb. Causes of a non-viable pregnancy. A baby born too prematurely to be able to survive, which is typically before 23 weeks. A congenital defect that makes the survival of the fetus outside of the uterus impossible. A pregnancy in which the fetus no longer has a heartbeat. And embryonic gestation, which is also known as a blighted ovum, in which the pregnancy stops growing after the gestational sac forms. Ectopic pregnancy, in which the fertilized egg implants outside of the uterus, and a molar pregnancy, in which a fertilized egg is incapable of survival and it implants in the uterus. Determining non-viability. Beyond extremely premature birth, the Society of Radiologists in Ultrasound have established definitive criteria to establish non-viability. This determination is meant to ensure that providers and patients are clear on when a pregnancy is viable or not, as well as to prevent the termination of a potentially viable pregnancy. Definitive criteria. Using an ultrasound, a pregnancy is declared non-viable based on the following definitive criteria. A gestational sac that contains no embryo but has a mean diameter of 25 millimeters or greater. A gestational sac with or is observed in a scan, but 11 or more days later, there's no embryo with a heartbeat. A gestational sac without a yolk sac is observed in a scan, but 2 or more weeks later, there is no embryo with a heartbeat. This means that the pregnancy has stopped progressing. No fetal heartbeat and a crown to rump length of 7 millimeters or more. Treatment is typically when a pregnancy is non-viable, it will either miscarry on its own or a surgical procedure such as the D&C or medication may be needed to remove the remaining fetal tissue. It's also important to remember that there are no treatments available or any ways at all to save a non-viable pregnancy. In many cases, having a non-viable pregnancy will not adversely impact future fertility. Often non-viable pregnancies occur due to chromosomal or other abnormalities that do not indicate a lasting fertility issue. What is viability? Viability is a term often used in medical circles. A viable pregnancy simply means that delivery would result in a live-born baby, and a non-viable pregnancy would not result in a live-born baby. Viability also refers to the survival rate for a child based on gestational age. A pregnancy is typically considered non-viable if a baby is delivered before 22 to 24 weeks, if the child has ceased to develop, or for reasons like the detection of genetic abnormalities. Science will tell us that even newly conceived humans are clearly alive, yet somehow viability has become synonymous with the value of that life. For example, those preborn children diagnosed with disability are often viewed as a life that has no value and should be ended in the womb. In past years, when a mother's life was threatened during the last trimester of her pregnancy, delivery was the best solution. Abortion proponents used to insist that late-term abortions would only be performed in the duress of circumstances, but times have changed and New York is leading the way. Whether women are seeking an abortion in their first or last trimester, the ethical dilemma here is pro-life believers are not prepared to assist those mothers who believe that abortion is their best and only option. Of course, there are different groups of people who have different opinions on what is best for their situation. There are times when a baby has so many different deformities that it would not survive life outside of the womb. The mother will make the decision to go ahead and abort the fetus from there. And however, some religious beliefs will not allow that type of termination of the pregnancy. So you must evaluate what is best for you and your own family.